I'm here on the National Mall in Washington with the Capitol building behind me. That Capitol building, of course, is where the men and women who represent the citizens of the U.S. in Congress and the Senate voted to pass the Affordable Care Act back in 2010. And now, the Capitol building behind me is where the men and women who represent the citizens of the U.S. are arguing about the Affordable Care Act. In fact, Republicans in the Capitol are saying that they are so opposed to the Affordable Care Act that they are willing to let the government shut down in the interest of trying to defund it or to continue to argue about it rather than letting it become implemented. And even as we speak, standing here, the government is shut down partially as a result of the Affordable Care Act. Nevertheless, on October 1st, the Affordable Care Act's exchanges, and that's a key part of the ACA, open for business. Those are the internet sites where everybody, but particularly the uninsured, can go on and shop for health insurance and see the premiums and how much they might have to pay based on their income and so forth. Well, we recently asked a significant sample of Americans without health insurance how familiar they were with these health exchanges, which opened for business October 1st, and the data tell us that the answer is not very much. Look at that. 25% of Americans who are uninsured, that is, don't have health insurance, say they're familiar with the health exchanges, leaving 3/4 who are unfamiliar. So there is a big road ahead for the ACA proponents in trying to get these uninsured people to be aware that these exchanges exist so that they can go on them and shop for health insurance. Which leads us to the second question that we asked of the uninsured. We reminded them that starting on January 1st, most Americans without insurance needed to get insurance or they would have to pay a fine. And then we said, all right, what are you going to do to the uninsured? Buy insurance or pay a fine? And you see the numbers in front of you. About 2/3 said they would buy insurance, but a healthy percent, 25% of uninsured Americans said they would rather pay the fine. Now, that's a problem because for the Affordable Care Act to work, according to experts who study it, large numbers of the uninsured, particularly the young Americans who are uninsured, need to sign up for health insurance because their premiums are needed to help pay for older people who are more likely to draw down on the system. So again, I would summarize by saying that while 2/3 of the uninsured say they'll probably get insurance, their recognition of the fact that they can get it through health exchanges is very low based on the fact that only about 1/4 say they aren't even familiar with what the health exchanges are. We'll keep monitoring through the fall the uninsured's awareness of these exchanges and keep you posted on what's happening as this brand new Health Care Act unfolds here in the United States. On the National Mall with the Capitol building behind me in our nation's capital, Washington, D.C., I'm Dr. Frank Newport, Gallup Editor-in-Chief.